Good morning, everyone. I hope you're all well today. Welcome to our Breastfeeding Month 2025 program with the team Forward Together. I am Miss Lyra Velarde, and it is my honor to be your host for today. We are delighted to have you with us in this virtual gathering where we will share knowledge, insights, and meaningful discussions together. Now, while we are still waiting for others to join, may we kindly remind everyone of a few online meeting guidelines. Please keep your microphones on mute to avoid unnecessary noises. Feel free to turn on your cameras if your internet connection is stable, as it will help us to feel connected despite being in the virtual space. You may use the chat box for comments, greetings, and later on to raise your questions. And most importantly, let's stay engaged and be respectful as we go through the flow of our program. Sharing is caring. Please share this live stream. Drop your location below so we can see where everyone is tuning in from, and you can also tag your friends and family. Thank you so much. All right, as we formally begin, of course, we would like to take a few moments to acknowledge everyone joining us today. Your presence means a lot, whether you're a mother, a father, a healthcare worker, an advocate, or a supporter of this cause. Each of you plays an important role in spreading the awareness and strengthening the community around breastfeeding. So, thank you so much for being here and sharing your time with us today. As we celebrate Breastfeeding Month, we are reminded of this year's theme, Forward Together, in which this means the importance of breastfeeding not only for the health of the mother and the children, but also for building stronger communities. And then now, as Olivares General Hospital continues to strengthen our commitment to quality healthcare and patient centered services, we are proud to share a milestone achievement that highlights our dedication not only to our patients, but also to every mother and child we serve. We are proud to share that Olivares General Hospital has been honored by the Department of Health with the Hall of Fame Award for the Mother Baby Friendly Facility Initiative last August 20, 2025. This recognition is a testament to our unwavering commitment to strictly implementing the 10 steps to successful breastfeeding and continued dedication to upholding the standards of the Mother Baby Friendly Health Facility Initiative. At Olivares General Hospital, breastfeeding is more than a practice. It is an advocacy we stand firmly behind. Now, we believe supporting every mother in her breastfeeding journey is essential in giving every child the healthiest start in life. This award strengthened our resolve to promote, protect, and support breastfeeding as an integral part of maternal and child care. Now, moving forward to shed more light on this important topic, we are honored to have a very distinguished guest speaker with us today, Dr. Joan Camille Santa Ana. Dr. Joan Santa Ana finished her medical degree at the University of Santo Tomas, where she graduated as cum laude. She then completed her residency training in general pediatrics and fellowship training in allergy and immunology at the Philippine General Hospital. Today, she will be sharing with us some important insights on breastfeeding basics, covering the essentials of what every parent should know. Ladies and gentlemen, please join me in giving a warm welcome to our speaker, Dr. Joan Camille Santa Ana.
Hi, good morning. Hi, good morning, my Ma'am Lyra. Hold on, let me just share my screen. Ayan. Kita ba ng lahat, ma'am?
Yes, Dr.
Yes po.
Okay. Hi, good morning, everyone. Good morning, mommies, daddies, doctors, nurses, and everyone else who's with us today this morning. Okay. We hope to make it worth your while, no? This morning, we're going to be talking about some basics on breastfeeding. But before that, let me just again introduce myself. But thank you, Ma'am Lyra, for that very warm introduction. I'm Dr. Joan Santa Ana-Maceren. I'm a general pediatrician and I'm also an allergist immunologist. Okay, so to start, here is just a short outline of what we'll be talking about today, okay? We'll be going through these topics briefly para meron tayong more time for question and answer. But for those of you who have some questions already in mind while I'm discussing, maybe you can type it sa chat box so that hindi nyo makalimutan, okay? So let's start. So ano nga ba ang breastfeeding, no? I'm sure all of us are familiar with breastfeeding, but breastfeeding is basically the act of feeding your breast milk to your baby directly through your breasts or indirectly through bottle feeding. And it provides your baby with sufficient calories and nutrients, including macronutrients and micronutrients. It is done exclusively for at least 6 months, and it's continued for up to 2 years or longer. Now, ano nga ba ang nasa breast milk? I'm sure marami sa inyo nakakarinig, breast milk is what we call liquid gold. So bakit nga ba ito tinatawag na liquid gold? It's called liquid gold because breast milk contains all the nutrients that an infant needs in the first 6 months of life, including fats, carbohydrates, proteins, vitamins, minerals, and water. It is easily digested, so madali siyang madigest or matunaw ng tiyan ng ating mga babies. And it also contains protein that help strengthen your baby's immature immune system, providing them with protection against various infections. So we said na maraming ang breast milk, it contains fats. Just a special note, meron siyang special fats na what we call yung DHA and ARA, which are important for brain development. Okay? So when we're babies kasi, our brains undergo significant structural and functional development during our early years, and breast milk definitely aids or helps in that brain development. Okay? So what else is in breast milk? Sabi natin meron siyang carbohydrates, meron din siyang proteins, and a special note lang din, no, yung breast milk natin, it is free of the protein that causes the usual allergy which is found in cow's milk. So mapapansin natin in some babies who are formula fed, sila usually nagkakaroon ng mga rashes o kaya mga eczema because ang cow's milk or yung formula milk, meron siya usually nung protein na nakakakos ng allergies na ito. Meanwhile, breast milk does not. Okay? Breast milk is also rich in vitamins and minerals. However, as an exception would be vitamin D. Okay, so mapapansin nyo, that's why a lot of your pediatricians would still recommend your early morning sunlight exposure for your babies, or sometimes we supplement with vitamin D drops for your babies kasi konti lang ang vitamin D na nasa breast milk. Okay, breast milk also has a lot of anti-infective factors like antibodies and other proteins that can kill bacteria, fungi, and viruses. Okay, moving on, ano naman ang colostrum? I'm sure narinig yun na rin to, no? Ang colostrum, it is actually the special milk that is produced during the first 2 to 3 days after delivery. Like antibodies, it is produced in small amounts, so konti lang siya, usually around 1 to 2 ounces lang siya on the first day. Pero okay lang, no? If you notice, mommies, na konti lang yung milk nyo, yung colostrum nyo during the first few days of breastfeeding, okay lang yun because that is all what your baby normally needs at this time. In fact, on their first day, ang tiyan ng mga babies natin actually kasi liit lang yan ng kalamansi. On their third day of life, lumalaki na yan ng parang size ng siniguelas. And on their first week, tsaka lang siya lumalaki ng parang kamatis. Okay, so don't worry if konti lang, if napapansin nyo, konti lang yung napoproduce kong milk, oh no, it's not enough, no, it's okay. That's what your baby just needs at this time. So don't worry about that. So this colostrum contains a higher percentage of your proteins, minerals, and vitamins than later milk to help protect your baby when they're first exposed to bacteria in the environment. Kaya it is very important that we start breastfeeding as early as in the delivery room, no? So pagkapanganak ni baby, pagka skin to skin contact sa inyo, you can already encourage breastfeeding so that they can take in a lot of this colostrum. Okay? Mapapansin nyo rin na itong colostrum na to, it's kind of yellowish in color. Okay? Because it is rich in vitamin A that is important for protection of the eye and the integrity of the skin. Okay? Next, how do we breastfeed, or ano-ano yung mga possible positions for breastfeeding? So let me just show you some common positions in breastfeeding. Okay. First is yung ating cradle hold. Okay, it is the most common one. Ito siya, cradle hold. So mommy, you just sit somewhere comfortable, and then you can actually use pillows to support your arm. You position your baby on your lap with their head sa bend ng arm ninyo, and you keep your baby's chest against yours. So parang chest to chest, tummy to tummy, para hindi sila kailangan mag-turn their head while they're breastfeeding. A general rule pala, no, while during breastfeeding, we have to make sure that the baby's head, neck, and spine are all aligned. So parang naka-straight line sila para hindi sila nagsistrain, hindi sila nangangawit, hindi sila nagsistrain while they're breastfeeding. Okay? Next naman is your cross cradle hold. Basically, kabaliktaran lang siya ng cradle hold. It is the reverse of your cradle hold. And this is a good option for smaller babies. Okay? So you position your baby in the opposite direction of the cradle hold with their head in your hand. That's a cross cradle hold. Another common position would be your football hold. If you're dealing with sore nipples, this is actually a good position to try because it also helps to prevent plugged ducts. So while you're on your side, you can hold your baby like a football dyan sa gilid, no, along your forearm with the baby's body on your arm. Tapos yung face nila nakaharap towards your breast. Okay? So that's the football hold. It's actually also useful for mommies who have twins. So pwede mo siyang sabay, no? Magkabilang kamay, magkabilang breast, pwede kayo sabay mag-breastfeed sa twins ninyo. Next is the side lying position, wherein you lay on your side and you place the baby also on their side facing you. So remember, chest to chest, tummy to tummy, with their head at your breast. And finally, you have your reclining position, wherein kunwari your baby, if your baby is restless and crying, this is actually a calming position to try. So you can support yourself with pillows and lean far back enough for your baby to be fully supported on your reclined body. Hindi naman kailangan fully naka-flat ka, mami, nakahiga na flat, no? Pero konting naka-recline, and then ipadapa or you lay your baby prone on your chest, nakadapa sila sa inyo while they're breastfeeding. Okay, so bakit nga ba tayo nagbe-breastfeed, no? Ano ba yung mga benefits na nakukuha natin for breastfeeding? So the benefits of breastfeeding are 100-fold, but let me just highlight some important ones in this lecture. First is for the baby. Again, we said it provides them with complete and sufficient nutrition. It provides them protection against diseases like asthma, diabetes, obesity, ear infections, and even diarrhea. This protection they get not just from the breast milk, no? Aside from the breast milk, the act of skin to skin contact, di ba? Pag nagbe-breastfeed tayo, skin to skin contact tayo. This promotes the transfer of good bacteria from the mom to the babies, helping them strengthen their immune system even more. And as we said a while ago, since yung breast milk natin contains yung special fats na DHA and ARA, babies who breastfeed are actually found to have higher IQs. For the mommy naman, ano naman ang makukuha ni mommy sa breastfeeding? So studies have shown that breastfeeding actually lowers the risk of certain cancers like breast and ovarian cancer. And it also lowers the risk of obesity, heart disease, osteoporosis, and even postpartum depression. It also aids or helps you in postpartum weight loss. And of course, it's very tipid, no? Very economical kasi hindi mo kailangan bumili ng formula milk na talagang alam natin medyo pricey, diba? And of course, for both, it promotes the bonding between the mother and the baby. So, the act of breastfeeding and skin-to-skin contact actually causes the release of your oxytocin, or what we call yung love hormone. And this oxytocin actually helps foster deep emotional connections between the mother and the baby. This also helps babies to regulate their emotions, and a lot of studies have shown that oxytocin release enhances both the mother's and the child's overall emotional well-being. So next naman, how do we know that our baby is hungry? So paano ko malalaman daw kung nagugutom na siya, no? So let me just show you some cues, no? So some feeding cues that you can watch out for to help you recognize